Thank you. You're welcome to let them in.
Why are you firing me?
Welcome. Thank you so much for joining us for our
Um,
webinar.
Ideally, I there's three shared clients between the two programs.
We are Mama's Voices, and we're so excited to be holding our webinar today. We have a lot of folks who are transitioning over from the waiting room, so I'm just going to give them a minute to get settled. Thank you all for joining us today. We are here to talk about developing a patient-centric screening process. My name is Jennifer McKennis. I am a program manager at Mama's Voices in our training department, and we are so excited to introduce to you a resource that is all about how you are screening with patients. And we call the resource a screening process implementation guide. So we're going to share recommendations for how that screening process could be implemented by providers or offices or facilities. And we'll also offer some suggestions on how this plan could possibly be used as a foundation for a quality improvement project that you could engage patients or family partners in. So let me just go through a few housekeeping items as people are coming in from the waiting room. Please drop your name into our chat. Feel free to include maybe what organization you are with. You can include what city you're in. This webinar series is generously being sponsored by the CDC, so we would love to report back to them on who attended. So as folks are coming in, feel free to engage in the chat, and that can be with your name, your organization, and where you live. We also kindly ask that you stay muted. We will have an opportunity at the end for you to ask questions, and we will invite you to come off mute at that time. And of course, please feel free as you consider questions you might have. We are going to save them to the end, but feel free to include them in the chat along the way. And of course, feel free to engage with each other in the chat. This is the third webinar in a four-part series on supporting patients with lived experience in substance use disorder, or SUD. And we are trying to identify ways that you can support them through their pregnancy and the postpartum period. So we had a webinar on patient engagement and then three webinars planned that included launching customizable pregnancy resources. So that very first webinar, it was 2 months ago, it was all about how to engage patients with lived experience in substance use disorder into quality improvement work. So we shared some of our practices on facilitating a listening session. In our second webinar, we introduced our very first resource, and that was a pregnancy plan that could be used to customize care for patients, but especially for those with lived experience in substance use. And if you didn't get the chance to attend either of those first two webinars, you can find those on our SUD resource hub, which sits.
Jen, you got muted accidentally.
Oh, I'm not sure what you guys missed, but in summary, we are on part three of a four-part webinar series. And three of those webinars are all about customizable resources that you can use with your patient. So we've already had two webinars. If you did not get the chance to attend those can be found in our substance use disorder resource hub, which sits on our Mama's Voices website. That is available for all of you to access now. And I believe one of my colleagues is going to be dropping that in the chat for you. That resource hub was launched 2 months ago and it continues to grow. So if you know of resources that you think should be on there, we invite you to share those with us and we're happy to make connections. That hub is intended to really be a central location for you to access dozens of SUD resources from trusted partners. The last two webinars that we have planned are all about two other pregnancy resources. So today we are going to talk about how to develop a patient-centric screening process. And then our final webinar will be on June 11th, and it will be all about coping mechanisms. And we are really excited about that. So how did these resources come to life? At the core of all of the work that we do at Mama's Voices is a simple belief that the patient voice should be at the heart of every project, not just as a participant, but as a partner. And that's what we're really modeling during our process of creating these resources. So we began by hosting our own listening sessions. We invited individuals and family members who had lived experience in SUD, and we had really honest conversations with them where they gave us a clear understanding of what they felt was missing in their healthcare and what mattered most to them. And one of those huge gaps that they identified was in how screenings are implemented with patients. So that's how this resource came to be today. The next thing we did after our listening session was we formed a work group, and it was made of some of our certified Mama's Voices patient family partners, including patients, family members, and providers that all had some experience in SUD, whether that be their personal experience or in a support role for someone else. And that group really played a key role in co-developing all of the content that you are going to see today. They made sure that every word, every suggestion, every message was reflecting real needs and real perspectives of patients. So for some of the elements that you're going to see today, for example, our guide includes provider script samples. We invited our patients to independently create content, and then they had the opportunity to review their peers' content. And I'm sharing this with you because I know that some of you might be considering how can you bring patients into your quality improvement processes. And so the way that we have created these resources might be something that you want to consider yourself. Our hope is that the resource is authentic, that it is informed, and that it's truly patient-centered. And before I dive into that, you might be sitting there thinking, how do these resources tie into quality improvement work? That's really what Mama's Voices is all about. Well, we work very often with perinatal quality collaboratives, with hospitals, with providers, and we teach them about engaging patients in quality improvement projects. But very often, what we hear from them is they've recruited patients, they've onboarded them, they're just not sure what kind of project to bring them into. And so, what we decided to do was create 3 concrete examples of pregnancy resources that could be used as is. We are giving you finished products, or they could also serve as a foundation for a quality improvement project with a patient. So this screening guide, for example, it includes some aspects that could be used as a starter template for a project. For example, you could convene your own work group of patients and providers, and there's something that we're going to show you called a patient resource worksheet. It's something that would be tailored for your community. We know communities have unique needs, unique access to resources. And of course, all facilities might have different required screening tools. So you could use this as a form of customizing what is right for your facility or right for your community. All right, so let's dive on into what's in our implementation guide. And let's start with the big, really important question. Why is screening needed? Why is it important? In maternal health, screening should not just be a checklist item that you complete. It's really an opportunity to identify risks early and to provide timely care for patients that's individualized. And when you are screening with empathy, you're not just detecting potential medical or mental health concerns, you're really acknowledging the whole person behind the pregnancy. So we are aiming to uncover gaps that might otherwise be missed, whether that is a physical health condition, behavioral health, a non-medical driver of health. Consistent screening really helps to normalize conversations about mental health and about substance use, and it'll reinforce trust between patients and providers. When it's done with care and when it's done with empathy, screening can become an act of support as opposed to an act of surveillance. So what is the screening process used for? Well, in maternal health care, it's a comprehensive approach. So you might be screening for physical conditions like hypertension, gestational diabetes. You might be screening for mental health. So you might be looking for signs of depression, anxiety, or mood disorders. There are substance use screening evaluations. You have screenings for non-medical drivers of health to identify maybe food insecurity, housing instability, maybe intimate partner violence. And then, of course, you have screenings for fetal health. So you might be monitoring for fetal growth. You might be trying to identify risks for stillbirth. Remember that screening is all about understanding and meeting your patients where they are and providing the support that they need. There are some special considerations when you are screening for substance use disorder. Screening, it's not just about identifying risks, it's about opening a door for them to create connection. It's about reducing stigma and making space for healing when they are ready for that. So the first thing you want to think about is that screening will help identify potential risks early, and that can significantly reduce adverse outcomes for moms and babies. Substance use can lead to complications. So offering support early and consistently throughout the pregnancy is really important. The process of screening should be allowing you to connect with patients with care that is supportive and that it's tailored for their unique circumstances. Every patient is different. So one patient might need support in the area of harm reduction strategies. Another one might find mental health counseling helpful. You might have another patient that would really like to talk about coping tools. The goal is to offer support options for them during their recovery journey and let them be a part of the decision making. And that brings us to a really important component, which is how you talk about substance use disorder matters. And you want to frame conversations in a non-judgmental way, in a supportive way. Use neutral person first language. Use a calm tone. A calm tone can make a world of difference in whether someone responds to you by opening up or whether they respond by shutting down. Remember that, unfortunately, many patients with lived experience in SUD have faced stigma in the past. So our role and your role is to build trust. And of course, lastly, screening is the first step towards integrated care. So connecting patients not only to prenatal providers, but maybe addiction specialists, behavioral health support, social services. When care is coordinated, outcomes can improve. So it starts with screening, with empathy, with intention, but also, and most importantly, with follow through. We're trying to give patients a better chance at a healthier experience for them and also for their baby. So how do you introduce that screening process? How you begin that conversation actually matters just as much as the screening itself. The goal is to reduce anxiety, make them feel safe, make them feel respected, and make sure they realize that they are in control. So you want to start by creating a welcoming environment. So what does that look like? Take a moment and connect with your patient as a person before you dive into the screening. Start with a warm greeting. Maybe ask them how their family is or how they've been since their last visit. Giving them space to talk without interruption, even if it's just for 60 seconds, it can really go a long way in establishing a rapport with them. Think about sitting down with them. Think about maintaining a gentle eye contact. Use open-ended questions, invite two-way dialogue. You are really setting a tone for a conversation, not for an interrogation. Then you want to clearly explain the process of what you're doing and its purpose. So let patients know that what the screening involves, and tell them why you're doing it. So clarify what the screening tool is. Emphasize why it's designed to support their health, excuse me. It's not intended to judge. It's not intended to provide labels. As an example, let's say you are planning to use the 4Ps method, where you're going to be asking them about their parents, their partner, their past experiences, their pregnancy, to guide a conversation maybe and identify areas where resources might be helpful. Before you do that, first explain to them why you are asking all of those questions. It is so important that you are being transparent with them, and also share with them how their responses to screening tools might impact their care afterwards. Share with them who else might have access to their results and what might come of that. Patients deserve to know if there could be actions taken based on their responses. We want to be honest, and we want to let them know that they are in control as they are taking these screening tools. We also want to normalize the process. So reassure them that screening is standard for everyone and that many people find it helpful. It's intended to be a proactive way to make sure that no one slips through the cracks when it comes to emotional needs, social needs, or physical needs. And then lastly, make sure that you are obtaining informed consent. Make sure the patient understands the process that they are consenting to. You could use something like a teach back technique where you ask them to repeat back what the screening is for. That helps you to confirm that they have understood what you are sharing with them. Maybe give them the chance to ask questions at any time and reinforce that they are in control. If at any point they feel uncomfortable, they can pause or they can stop the screening entirely. I want you to think about clarity, think about consent, think about honesty when you are trying to make space for them to give you honest answers in return. So you've welcomed your patient, you have introduced the screening process, and then you have administered the screening tool. You likely have a required screening tool that's designated by your organization. So that's why today we're not telling you what screening tools to use. That's really up to you. We're telling you how to approach this with your patients. So let's assume you've now administered that screening. What happens next? Support doesn't end with the screening. It's actually what happens next that really makes a difference. And timely connections can be life-changing for patients. Don't forget, schedule follow-ups with them. You are trying to build continuity with them. You are trying to build trust. This is just not a one and done. We want to continue to refer back to what is most helpful for them. So, for example, let's say you have someone who screens negative and they are choosing not to complete, or they're choosing not to complete a screen. It's still really helpful to proactively provide information that they might need in the future. So you're going to hear a lot today about how we would suggest that every single one of your patients get connected with resources. And you do that proactively. They might not need it now, but they might need it down the road. So what kind of resources are you connecting them with both before and after? Start by providing referrals if they need it. So if a patient were to screen positive for, let's say, depression, anxiety, substance use, make sure you have a process for connecting them with mental health professionals. Maybe maternal fetal medicine specialists, or maybe substance use counselors. It's really critical that patients don't leave the appointment without a clear next step, especially if they are in crisis or if they are at high risk. In addition to referrals, you also want to provide educational resources, and you can tailor that to what the patient is experiencing. So that might include handouts on nutrition during pregnancy. It could be safe exercises. It could be stillbirth prevention techniques. It could be coping tools for anxiety, maybe managing chronic conditions. Every patient has a unique set of needs. So giving them the knowledge that they need will empower them to help take charge of their own health. You also want to coordinate support services for them. So especially when you have non-medical needs, maybe they have challenges with transportation, challenges with childcare, Having a list of local resources in advance can really make it easier for you to connect patients with the help that they need. And we're going to show you in a little bit a tool that we've created to help you get started there. Whenever possible, if you can collaborate with the patient to make your plan, we encourage you to do that to ensure that it's personalized for them and that they also are buying into the plan. Ask them what is most important to them and work with them to set small, achievable goals that are reflective of their priorities. And then, of course, think ahead. Even if a screening doesn't indicate that immediate need, you want to be proactive. You're going to hear me repeat that several times today. Offer resources now, plant the seeds for future conversations. Here's an example. Let's say someone is in very stable housing right now, but they casually mention that they have some job insecurity. You might say something like, well, here's a resource that you can keep just in case your circumstances change. And then lastly, make sure that you have a follow-up plan in place. So for patients who do screen positive, schedule that check-in so that you can reassess. If you have made a referral, confirm that they received it or confirm that there was follow-up. Patients are much more likely to engage with support if they feel like you, as their provider, are walking them through the process of getting that, as opposed to just sending them on their way. And we're going to share with you different aspects of our implementation guide that we hope will be helpful for you to keep that organized, something easy that your patient can take away from their appointment. So the follow-up and how you communicate is really where you are solidifying trust with patients. So your screening is complete. You have potentially given them some resources beforehand. And now you want to review again with them and share screening results transparently. You want to share it with compassion. You want to invite them to ask questions about their results. You want to invite them to share concerns they may be having. Ask them open-ended questions. You could use motivational interviewing techniques. Those are very incredibly powerful tools. They help you to dig deeper, especially when standardized screenings don't necessarily tell the full story. Some patients might actually opt out of screening. Some of them might provide the right answers because that's what they believe is expected. So don't be afraid to ask them open-ended questions like, tell me more about your living situation. What's been on your mind lately? How are you feeling about these results? Maybe asking them, what would be most helpful for you right now? Those questions might not be on the screening tool. You might get better quality answers and information to help inform the support that they need from open-ended questions. And then whenever possible, if you can schedule their referrals for them, we recommend that you do that. And of course, on an ongoing basis, when you see that patient again, revisit the plan and readjust as needed. Your message to them really should always be, we are here, we are listening, and we care. Let's talk about the postpartum period. That can really bring tremendous emotional, physical, psychological changes. So connecting patients with postpartum health information is really important. Ask them about future pregnancy plans too. Maybe something as simple as, are you planning to get pregnant in the next 18 months? That can help you guide them on whether you're connecting them with maybe preconception information or contraceptive options. This postpartum time period is also when mental health support is especially crucial. There are validated tools to screen every patient for perinatal mood and anxiety disorder. Your facility probably designates that for you. We recommend that you are screening every single patient for that. Normalize asking for help. Tell patients that seeking help is a sign of strength, that it is not a sign of weakness. You want to be alert for signs of postpartum psychosis that would require urgent care and urgent support for your patient. And of course, as always, remind patients, you are not alone. You are not to blame. Getting support for your mental health means that you are doing what is best for your baby, and we are here to help you every step of the way. So, as I mentioned, our implementation guide includes a lot of the things we've talked about so far. It also includes sample provider scripts that you could use. And the language in these provider scripts was written by patients, and it was designed to be supportive, to be non-judgmental, and to be empowering. It's broken down into sections, and those sections include things like how to explain to the patient the purpose of the tool, how to normalize feelings, how to explain what happens next. This is a guide to help you build trust and make sure you're speaking in a manner that reduces stigma. But it's really important that it feels authentic. Do not use it for the first time in front of a patient. So there are some strategies listed on here that you could use to prepare behind the scenes. So you could role play with a colleague, maybe taking turns as the patient and the person who is administering the screening. You could conduct simulation scenarios for your entire team. Self-practice can be really helpful because as you are saying something out loud several times, you are acclimating those words to your own personal language and your own personal communication style. It's not about reading word for word when you are with a patient. It's really about getting comfortable with the language so that it flows smoothly. And when you are delivering that message to them with compassion, it really will feel natural to them and very genuine. And that can impact how patients experience this screening process and how they experience their care from you. It is telling them that we see you, that you are safe, and that you matter. Okay, so now that we have talked about how you can implement the screening process, I'm actually going to switch over and I'm going to pull up the implementation guide. So give me just a moment here. Okay, so you should be seeing on my screen, this is the implementation guide. This is downloadable right now in our SUD resource hub. So one of the things that I wanted to share with you is what we have created as something that you could take away and use tomorrow with your organization. So you can see, just going to scroll down here a little bit. There's the implementation guide, there is a patient resource worksheet, and then there's the provider script. And a lot of these are sectioned off to make it easier for you to understand how to implement this. And I'm going to keep scrolling because there's a section that I want to show you that's really important. There are some clickable links in here for resources. They will take you to some of those wonderful SUD resources that we are including in our SUD resource hub. Okay, so I'm scrolling down here and I'm looking at what we call our patient resource worksheet. And so this is intended to be given to all patients before they ever take any type of screening tool. And so I'm going to read the directions out loud to you. This is intended to be a patient-facing worksheet. So the resource includes up-to-date information on local community resources that are available to all patients. We made sure to include that on this document because we want them to know you are not singling them out. You have not made any judgments about their appearance, their life. We want them to know that this is something that is just standard procedure in your office or in your facility. And then the directions say during patient visits, you and your provider will use this form as a guide to identify where additional support may be needed. So for example, if you're looking at this top section, we recommend that you are filling this out in advance. And I'm going to talk a little bit more after I show it to you about how I would recommend you use this in your office. But all of these sections on the right, we recommend you have completed in advance. So this top section is you connecting them with some of the key important organizations that are available in the community. Give them the contact information for the health department. Does your community have regular baby showers? I attended a community baby shower a couple weeks ago, and it was such a shame because there were a lot of really great resources and freebies given away there. That would be a great place. For example, where I live, we have Healthy Start. So we would include maybe the contact information for Healthy Start here, and that's a place where they can go for additional support. There's a section in here on general support. So these are a lot of your non-medical drivers of health. So think about, do you have patients that might have transportation challenges, that might need a little bit of help with food assistance? They might need some help with bill pay. We don't want to make any judgments or any assumptions that they're going to share that with us. So we recommend you have this completed in advance, and every patient has access to where they go in their community to get support. There's a separate section down here all about pregnancy support. Let them know how to access the local diaper bank. Do they need help with a lactation consultant? Do you have a free service in your community? Do they need help with baby supplies? If they don't have a car seat, where could they go to get access to a car seat? They don't have a safe place for a baby to sleep. Where could they go to get help to secure some kind of crib or pack and play? Are there doula or birth support programs available in your community that you can connect them with? And then this is just a front and back document. So on the back side, we have an entire section on offering substance use support, mental health support, and family support. So you can see in the substance use support, you are trying to connect patients with things that they might need. We are not, at this point, we're not asking them, do you need help with these things? We are letting them know, here is where you can access support for these things. I recently heard of a community organization, it was a hospital, that sent every single mom home with a first aid kit. And that first aid kit included naloxone in it. And they really normalized that every single patient, every single person should have this in their home. They should have this in their car. Might not be needed for you, but think of it as you would a fire extinguisher. You don't think you're going to need a fire extinguisher, but you just want to have it around just in case. This is where you also can get them in touch with counseling programs that are available in your community. You have NA, AA meetings, Nar-Anon meetings. Connect them with inpatient treatment programs. Are there any family-friendly treatment programs? You know, those are hard to come by. If you have that as a resource in your community, let them know. And of course, outpatient treatment programs. And then similarly in the area of mental health, please send them home with information about a crisis hotline. The national crisis hotlines are available, emergency services. Connect them with mental health counselors or support groups. There are so many support groups available in the community, and a lot of people are afraid to ask for help in those areas. So if you know of any that are free and available, include that here. And of course, things like psychiatry services. You've got a section down here for family support, parenting education and classes. If those are available, let them know how to access that. And home visiting programs is helpful as well, if that's available to them. There is space at the bottom for you to document for them what happens next. So we talked about connecting them with referrals. If you have identified areas where you both agree it would be supportive for them to connect with someone else, this is where you can document that so that your patient knows exactly what's happening next. And you want to be really clear if they should be calling to make that appointment, if you have called and they should be expecting a call from that office, or if you are scheduling that meeting with them. So we try to make this very easy for the patient to understand what So I just want to go over a few tidbits on how I would recommend you use that patient resource worksheet. It is really intended to be that practical way to connect all patients with the resources that your community has to offer. It is so much more than just a handout. And when you are using it intentionally, it can be the bridge between screening and then the real world support that they need. So we recommend that you complete this worksheet in advance. So designate a person in your office or on your team that's going to be the one who is completing this. So that might be a case manager. It might be a patient navigator, a social worker, an office coordinator, could be a nurse. Their role is going to be to keep this resource up to date and accessible. And then that person is going to populate it with the local resources that either your clinic offers or that you can refer them to. So that's where, your housing support, transportation, food programs, things like that. You want to set a reminder to review and update this list at least quarterly, because if these are not up to date resources or up to date contact information, then there's no point in giving it out to patients. So how are you going to share this worksheet with patients? You want to give it to them before the screening begins. I'm going to say this again. You want to give this to them before the screening begins. You are trying to create an environment that is supportive from the very start. And this really sends a message to them that your team is ready to help no matter what the results of the screening test are. Every patient then leaves your office knowing how to access resources. Again, they might not need it right now, but they might need it between now and their next appointment with you. Make sure you review it again after your screening, especially if the patient has expressed a need or maybe if they have screened positive in any areas. So you sit down and you talk through this list. Work with them to prioritize what their needs are and ask them what feels most urgent or what would be most helpful right now, and then develop a plan together. So whether that is setting them up with a connection to a food pantry or maybe scheduling a counseling appointment, the worksheet is really turning your screening into action. And we tried to make this a super low tech tool. I'm sure there are fancier ones out there, but we wanted to make this accessible to everyone. And we are hoping that it allows patients to feel supported and empowered to seek out support when they need it. Thank you so much for joining us today. We really appreciate that you are here to learn about this implementation guide. We want you to remember that patient-centered screening is an opportunity for you to build trust, to listen to your patients, and to offer support. Remember, we're trying to tell them you matter, we see you, we are here to help. All right, so this brings us to the end of our webinar. As you are downloading this resource, if you choose to use this resource, we would love for you to share feedback with us about what you find helpful, but especially if there's something that you think we should improve on here, we would like to hear it. We would like to see it. We are considering this a living, breathing document. So at all times, we'll have our most up-to-date version included on our website. So we invite you to email us at mamasvoices@mamasvoices.org. One of my colleagues is going to drop that email somewhere in our chat, I'm sure. We have one last webinar in our training series. You can register for that last webinar through our SUD Resource Hub, and that QR code is up on your screen here. That webinar is June 11th, and it is identifying and managing coping mechanisms. We are really proud of this tool that we've created in partnership with patients with lived experience in SUD. All right, so grab that QR code if you haven't already, but I am going to transition over to questions. So if you have any questions, you can either drop those in the chat, or you are certainly invited if you'd like to come off mute. We would love to hear your questions verbally. While I am opening this up and answering questions, you also should see on your screen, we've got a really quick poll. We would love to invite you to respond to our poll and let us know if you found this helpful. Okay, I'm going to pull up my chat, see if there are any questions in here. And I'll also invite if any of my colleagues, so many of my team members are on here today. I welcome you to come off mute also if you'd like to answer some of our questions that we have.
I have a question.
Sure.
Um, I feel like one of the issues that I have in my health system is keeping those resources updated, and that feels like a whole full-time job, making sure that um, the handout that you said, oh, if you need a baby shower or access to crib materials or those sorts of things, I feel like it changes so frequently that I find it really hard to get provider groups to buy in or inpatient nursing to buy in, giving out those handouts because they change so much. And I feel like social work is so overwhelmed that they won't manage it either. I don't know how you've gotten around that in your experience, but the management of that living document of resources is so hard.
Yeah, thank you so much for sharing that. We have heard that before. I was just at a conference and there were so many people sharing about, they were calling them community resource mapping, and they were sharing about the process. And they were also sharing that one of their biggest challenges was how time consuming it is. So I don't know if I don't have the answer for you. And I welcome if anyone on the call has any suggestions, I welcome you to also engage in the chat or come off mute and share. Um, Perhaps it's sharing the responsibility. So if you maybe you have a designated person in the office who will always keep in touch with the local community resources for SUD. And I don't know, maybe you have another person who their area of expertise will be in the mental health support. So I don't know if sharing the load makes this a little bit more manageable. I'm not sure if that is an option. Um, I don't have the answer for you because I do share in your concern that it can be time consuming. Um, if you can send them to websites, and I say a website, if you have the privilege of having a community resource, I use Healthy Start as an example because our Healthy Start has a coordinator and their job is to keep those things up to date, but not every community has something like that. But if you have an external organization that is already doing that work, connect with them. Stay in touch with them. Maybe sync up if they on a quarterly basis update their website, maybe sync up your updating with theirs, so that you're not duplicating any efforts. I don't know if that was helpful. If
That
there's
was
a,
helpful.
okay.
Yeah. Yeah, I think we just have to find a system in place. There's lots of good answers in the chat. So thank you so much for your feedback in the chat as well as your active voice, Jennifer.
Oh
Thank you.
yes. Oh yes, I'm reading them now. Thank you.
Yeah, yeah,
Yeah, contact the local health department. I That is such a great suggestion,
yeah,
Rebecca.
that really is.
They are in touch. And if your state issues education or updated resources, the health department is usually going to be the first one to hear about it and update, their own websites. Heather, I do you have a question or an answer?
I have an answer.
I would love to introduce one of our patient family partners, Heather Martin. If you could, please, we would love to learn from
So
you.
I'm from the little state of New Hampshire, but it's super big when it comes to finding resources for moms and but we actually have coalitions. So I don't know what state you live in. We have coalition work going on, and that's part of the coalition work. So believe it or not, my little state has 11 coalitions, and they're each working on different projects, updating the resources, but it literally is a full-time job. And we created a New Hampshire Mom Hub in our state, and that's literally going to be my full-time job is keeping all the updated coalition information, providers, it's groups, it's everything that has to do with moms. And it's a full-time job. I'm constantly getting updated groups, which is amazing. And the more that we say that we need things like that, and the more people get things going. So I don't know what state you live in, but like your coalition, if you have a PQC, like those types of organizations can work
Okay.
together, hopefully, and make that happen. And the health department is a huge thing too. We rely on our health department for updated. info. Hope that helps a little bit.
Thank you so much, Heather. And some of the other suggestions in the chat are great. Creating an internship program. Students are eager to dive into the work, and that's a way that they can really make a difference. Using your PFAC, your Patient Family Advisory Council, that is brilliant. Thank you all so much. If any of you also have suggestions, please feel free to include that in the chat. I did see a question and I apologize. I lost it somewhere up there, so I'm not sure who made it, but there was a question about if IPV is included on the worksheet. So I think you're referring to intimate partner violence. We did not include that directly in there, but we kept this open-ended. So if you have resources that you want to include in there, we recommend that you do that. And as I mentioned at the very beginning, this is not all inclusive. So we encourage you to customize this for your organization or for your community. And that includes, adding other areas that you think would be helpful. Honestly, after hearing that request, that makes me want to add this to the worksheet. So I'm going to take this back to our team. And there's a really good chance that might be on there in the next 48 hours. So thank you for whoever suggested that. Oh, Lindsay suggested, looking out there to see if there are already existing resource hubs, specifically for Nebraska. Oh, that's great. Find Help is fantastic. I have heard that time and time again. If you are not familiar with Find Help, when you go to that website, you drop in your zip code and it connects you instantly with things that are available in your community. Like even things like you are an expectant parent and you haven't had a dentist appointment in a while, they can connect you with services to offer dental support. You name it, you might find that on there. That's a really great suggestion. Thank you so much. Okay, so New York City has, I think, CRI, so Community Resource Inventory. I think that's what that stands for. And you let me know if I interpreted that wrong. Kayla is mentioning that they use Help Me Grow. That helps them keep updates on perinatal resources. That's wonderful. Oh, you guys are, I love that you are all here supporting each other.
Yeah, and I'm just going to come off mute for a second to say that thank you for all the suggestions. We will make sure to include all of these in the follow-up email. We always send out the recording and the slides afterwards, but we will definitely include all of these as resources for everybody.
Thank you so much, Lainey. Do we have any other questions? And my team members who are here, if you see any questions in the chat that I am missing, please let me know.
Jennifer, this is Shelby Lassiter from North Carolina. And question for the group as a whole. What are your thoughts about screening for need when there are no readily available practical resources? We here in North Carolina, as do many of you, have significant maternal health deserts, and we often run into transportation issues, et cetera, and there's no community resources to, refer to. We work with patients, our hospitals and staff work with patients on an individual basis to mobilize, religious congregations, other, resources, tap into that, but it's a one-on-one kind of thing. There's not like a resource we can give them that's even close by and practical for the person. So thoughts about, if we can't do something about it, give them a resource, do we even screen for it?
That's a really good question, Shelby. And I have heard people make the recommendation, what is the point of screening if you don't have anything to offer them? I'm going to actually open that question up to the group. Anything that we could share with Shelby and with the rest of the attendees here today?
Yeah. thank you all. Certainly the cab service. I have one county in North Carolina with no cab services at all. No Uber. They're that rural. So we depend on support, friends, family, etc. And, having
Thank you so much for sharing. I think Sadaf, I think you have your hand raised, so I would love for you to come off mute if you're comfortable doing that.
Sure, yeah. I just wanted to address Shelby's question. So, in some of my work, we've also found that even when there aren't any direct resources available, sometimes it just helps in talking to the patient about these issues and maybe the provider taking this into consideration in their care plan, for example, or how to manage the patient better during their pregnancy, after their pregnancy. And even if there may not be substance use resources available, maybe connecting them to social needs resources that could be available in the community. So I think it's just a way to open the door to meet other needs also that the patients may have.
Thank
Thank
you.
you. Yeah, I echo that. Thank you so much for sharing. Um, just making sure I didn't miss anything else in here. Yeah, screening gives you an idea of the extent of the need. There's just something that feels so welcoming being asked how you are doing and what your needs are. And even, just think about in your normal relationships in life. Sometimes you want people to solve your problems, and sometimes you just need somebody to listen to you. So having that conversation, thank you so much, City, for sharing that. Just opening up the door and having that conversation, you are offering another level of support for them that they just might not have anywhere else. Thank you so much, Riley. Riley is saying it's so important to screen because there could be alternate pathways for them to address the problem. So if, for example, they're asking for help with rental assistance, you might be able to get them a resource on budgeting. That's such a great perspective that we don't know just one way to support them. We don't have to have just one way to support them. We can get creative. Here's support groups that facilitate at home. Thank you so much. These are really great suggestions. I will keep the line open if anybody else would like to ask questions, if you would like to share anything. If there are any questions in the chat that I missed, please certainly feel free to come off mute.
I have a question. I wanted to know, have you created a QR code for the form?
Not directly for the form. We only have a QR code for the SUD Resource Hub. But
I was actually telling them we could definitely create a QR code that goes directly to this like patient document, but it would be like to a PDF file. But it definitely spawned my thinking. I do a lot of the patient engagement and education for the Preeclampsia Foundation, and we could certainly adapt something like this in sort of like a mobile format. So it kind of gave me some thought about like what this could look like in a version 2.0, but we can also, it's a really quick process to just make a QR code for this that goes straight to this resource that you guys could have. And we will include that as a JPEG in the email follow-up, which would be a great resource. And we'll also make sure it's on that SUD Resource Hub page. Great idea.
Perfect. Thank you so much, Lainey.
Yeah, thank you. Yeah, that's definitely helpful because they can have it on their phones all the time. They can share it with other people who might need it as well. Sometimes they'll ask for somebody else and it's really for them, or they can use it for somebody else if they don't really think it's helpful for them. So thank you.
And if you're customizing this and actually capturing all of your content in there so that they have access to that, there are so many free ways to make QR codes. So please feel free to go and make your own once you have it populated with your own information. Okay, so Carly's asking a question. How have others managed the time constraints during patient encounters to effectively complete the screening process and connect patients with appropriate resources? I'm going to open it up to the participants. Anybody have any words of wisdom or things that have worked for them and for their office, how to manage time constraints? Carly, we're going to take that as an action item on our part. If we can get some answers for you, we'll definitely share that out. Heather shared that they do it before the appointment. That's great. If you have a patient portal and your patients can access the patient portal, that's another place where you can keep that. Some patients read those things in advance, some don't. Some read them diligently after their appointment, some don't. So you don't want to ever assume that they're going to view that, but it could cut out some of the time. Oh, Jacqueline shared some of that is self-administered or having a staff member do it with them, maybe in triage. Well, thank you all so much for coming today. Thank you, Jacqueline. You guys can keep the suggestions dropping in, but we really appreciate you. We hope you will consider joining us for our June 11th webinar. Between now and June 11th, dive into that SUD resource hub. Take a look at what we have out there. There are the customized resources that we made, and then there are so many more from trusted partners, from national organizations, and also from a lot of the perinatal quality collaboratives. You'll see those are broken down by states that share those resources with us. So we invite you to take a look. And then if you have access to resources that you would like us to connect to, please share those with us. Would be delighted to connect people with things that are free and accessible for them. Okay, we're getting close to the top of the hour. So I'm gonna just say a tremendous thank you from Mama's Voices, and we'll go and close out things, and we will see you on June 11th. Thank you so much.